Hi, everyone. Welcome to this presentation on which supplements actually help your prediabetes and diabetes. Happy to have the Pitt River Health Service audience with us today. I'm Theresa Garnero, and with me is?
I'm Stephanie Bouquet.
Right on. We're both certified diabetes care and education specialists. I'm a nurse and she's a dietitian. So let's just jump in, Steph.
Sounds great.
So how
So,
would you define a supplement? What is it?
right. Well, and I get a lot of questions about this. What supplements should I take to improve my diabetes or prediabetes? I think the first thing we need to talk about is that a dietary supplement, that name, is just an umbrella term, and it can be anything from vitamins and minerals, but it also can be supplements like protein shakes or different powders that you put in, botanicals and things like that, that you might put in a drink or that type of thing. But I will say most of the time people will use supplements to mean vitamins and minerals. So that's what we're going to kind of focus on today.
Okay. And I like what you
They're
put here, foods first.
Yeah, so I mean, the supplements are super popular and everybody wants to pop a pill to improve their health. But really, what we're finding is the best evidence that we have is that food really gives us what we need. And we actually don't know what all the nutrients are in food yet and how they work together for health purposes. So we always say eat first, which I like that.
Yeah, and the limited health benefits, I mean, some of the studies that you're going to talk about have been well thought out, but others are limited. So I'm glad you're going to cover this.
Sure.
All right, let's start with how is this industry regulated?
Well, this is kind of a scary thought, actually, but our supplements are not regulated really by the Food and Drug Administration, which is our big body in the government that regulates most foods and drugs. There is a separate act that was created back in 1994, big mouthful here, Dietary Supplement and Health Education Act. And I will tell you, it's a big business. People want to get these different products on the market. And what the Food and Drug Administration looks at is they will just look at the different ingredients that are going in the actual supplements. But they only really tend to regulate if there's a problem. So manufacturers don't need the FDA's approval to make their product, and they don't have to provide the evidence that there are health benefits. They only need to provide that the ingredients are safe for consumption.
Wow.
I
That's
know. So it's scary because we don't know how they work in combination. Now, I will say that some of the brand name vitamins and minerals have their own guidelines that they follow as well. So, I mean, you definitely can trust the bigger name supplement um, companies.
okay. All right, let's start with multivite. I mean, I always thought, it's a good idea, but I didn't really know why, being a nurse. What's your comment on that?
Sure. So multivitamins, I tend to think of that. Most people think they're just a bunch of vitamins thrown in there, but I will tell you that multivitamins also contain the minerals. And so it's just like a blanket in terms of, or an umbrella, considered insurance to balance out any deficiencies that your diet may have. It's certainly not a substitute for, oh, I'm going to eat fast food all day, so let me just pop some multivitamins and then I'll be eating balanced. It really doesn't work that way. I do caution with using multivitamins that are mega doses. And what that means is if they're above 100% of the RDA, which stands for recommended dietary allowances for any component. So more is not always better.
Mm-hmm.
And the biggest key, Teresa, and I'm not sure if you're familiar with this, is that you want to take your vitamins with food. Vitamins do not provide you energy. You don't get the benefit from them unless they are combined with foods that you're eating, then they work.
Yeah, I learned that the hard way,
Yeah.
oh, I need to take my vitamin, and then it wasn't with my breakfast, and then it made me feel kind of ugh. So then I do the chewy, and that's better. But yeah, yeah, definitely take it with food for it to be efficient or effective.
Right. There are a couple exceptions to that. The biggest one is if you your doctor tells you to take an iron supplement, that needs to be on an empty stomach. But pretty much every other vitamin you want to take with food.
Okay.
Yeah.
Why don't we start off with vitamin D?
Vitamin D.
You get a lot about vitamin D.
Yes, and it's getting a lot of hype. In fact, when the food labels, the labels that you see on all the products, when they were revamped about 3 or 4 years ago, vitamin D became an important vitamin to put on the label. And that's because it's very important for our bone health. It actually works with calcium for a whole host of things in the body, but it really does work with our immunity, and it keeps us well as well. So DRI is boy, I can talk today. DRI means daily recommended intake, and so it'll give you an amount that's recommended. I will tell you the majority of vitamin D comes from not the foods we eat. This is one exception, but actually the sunshine. So when we sit out in the sun, the rays will hit our skin. Right underneath our skin is a component called cholesterol. And from that, we actually synthesize vitamin D.
That's pretty cool.
Interesting.
And then
yeah, pretty cool.
Well, what about you put on sunblock? Are you blocking out?
Yes, so that's the huge issue is, we are now a nation of sunscreen, right? We don't want wrinkles. We don't want skin cancer. We really don't need that much direct sun exposure. It's only about 10 to 15 minutes per day. And it can be when it's cloudy outside also, you're still getting those rays. Our biggest absorption is in the face and kind of what they call the décolleté. Is that how you say that? The right here, the neck.
An insulin medication. It sounds like a medication.
I think I probably pronounced that incorrectly, but you get the idea. It's the neck area. And then also one of the other reasons we're deficient is there aren't a lot of food sources, as you can see right there. A lot of people may not eat those types of foods, the yolk of the egg, dairy products that are fortified with vitamin D. All dairy products are. And then the fattier fishes. So they might have a limited food source. And so that may be an issue, but also depends where you live and how the sun shines. So it depends how far from the equator you live, and you get less sun exposure the farther away you are.
Oh, interesting.
So, kind of interesting.
Yeah, things you don't think about.
Yes, exactly. So vitamin D is considered a fat-soluble vitamin, which means it's dissolvable in fat. So what does that mean? Well, it means that if we take in too much, it's going to store in our body, our fat tissue, basically. And so for a long, if we're doing mega doses of it, it can store up and can cause some issues as well. So we want to just kind of watch how much we're taking in with fat-soluble vitamins. And then lastly, if you are going to take a supplement, there's actually 2 forms: vitamin D2 that comes from plant sources and vitamin D3 that is derived from animal sources. We do know that vitamin D is far more superior in terms of absorbed ability. But if you are a vegetarian, you don't consume animal products, then vitamin D2 is a great source as well.
How is this measured to be sure that you have enough in your system? Aren't there like annual labs that you go have your blood drawn once a year? What's the recommendation?
Yes, that is correct. It is and I recommend it on a yearly basis. But it is a blood draw, and many times you do need to ask the doctor for it. Not all doctors think, oh, that's just in a regular blood panel. So definitely want to get that checked. And if it's really low, and sometimes it's really low, they actually can prescribe at that point prescription strength vitamin D. That's a really big dose.
Okay, thank you.
Yeah.
Vitamin B12. This is a really important one given the last bullet point on the slide about metformin, but we'll wait for that. Tell us what this is for and how much we should have and what are some things to consider?
So vitamin B12, I feel like this is kind of the forgotten vitamin that a lot of people are just unaware how important it is. It's actually very important for blood cell regulation and also kind of the coating on our nerve cells, myelin sheaths. And what we do see sometimes with individuals that have had diabetes for a long period of time or elevated blood sugars for a long period of time is sometimes those sheaths or nerve cells can be kind of coated with, if you have higher blood sugar or hyperglycemia for a long period of time, and it can kind of change how those nerve cells work. And there can be some issues with that. So it's really important that we want to make sure that we get in vitamin B12. It is different than vitamin D in that it is a water soluble vitamin. So it doesn't store in the body. So if you take too much B12, really you're just paying, what I say, you're paying for expensive urine because it tends to just kind of flush out. Food wise, and that really is your best source to get B12, is through animal food sources only. It actually attaches to the protein in animal foods. So that makes it a little bit challenging for individuals that aren't consuming animal-based foods. But there are quite a few foods that are fortified with B12, and I've listed a couple here. I think of those three, probably the biggest one that I recommend are cereals. A lot of the breakfast cereals will have B12 added to them. Total cereal is probably the biggest one with the biggest amount. Have you ever tried Total?
I have not tried Total. You know, I think part of the challenge with cereals is that it spikes the glucose so high. And so, you know, you look at the serving size and you're dealing with such a small amount. But, you know, you can still have it. It's just, can you have that small? So what,
And
3/4 of a cup or?
Right. And I actually recommend using cereal more as kind of a condiment, like if you're having a yogurt or something like that, instead of using a high fat granola, you're going to use the cereal instead. So you have a smaller portion, but you are getting some of that B12.
Yeah, the nutritional yeast, that's fun to put on popcorn too.
Yes, and it's really tasty. It's a nutty taste.
Tastes like butter.
And you can get that. You don't have to go to, you know, a fancy nutritional supplement store for that. Nutritional yeast is available at most grocery stores now. Yeah. So the next bullet point talks about intrinsic factor, and that's something that our stomach has. It's connected with our stomach acid. So in order for B12 to actually be utilized in a food source, it needs that intrinsic factor. And as we age, sometimes our stomach acid decreases, and so that intrinsic factor will decrease. So consuming B12 meant, you know, it could be that you're not absorbing it all. So that's could be a reason why vitamin B12 decreases.
Can I ask, do you know what the relationship is for people who are carrying extra weight and maybe they have the gastric reflux and they're taking medications to decrease the amount of acid in their stomach? Would that mean that it would interfere with their B12 absorption as well?
It actually could. That's a good point if it's in a large amount. Yes, like if they're taking mega doses. So yes.
Okay, interesting.
I guess it is the short answer.
Okay.
And then the last bullet point that you mentioned at the beginning is that the medication metformin can also increase the risk of B12 deficiency.
Yeah, that's a tongue twister, right? So a lot of people don't know this. Up to like a third of people who take metformin, which is like it's the number one medication that's prescribed, but it can cause the B12 levels to fall. So it's something that needs to be measured annually every year, and it's something that could be missed completely. So make sure that your primary care or your diabetes provider is checking for that. Okay, are we ready to talk about cinnamon?
Cinnamon. So this is kind of a fun one because, you know, this is probably something you have in your cupboard. But what we've seen or what studies have shown is that it may, so I always preface that word, it may improve insulin sensitivity and glucose intake.
Oh
It's
yeah,
really
uptake, intake, because you have it on a Cinnabon.
Right, exactly. That's kind of defeating the purpose there. But that rich color of cinnamon, that contains the antioxidant polyphenol. And that is shown to also lower blood pressure. So not just blood sugar or improving insulin sensitivity, but also lowering blood pressure. So nice. Now there are different variants of cinnamon. And these are big mouthfuls in terms of the types of cinnamon, but it is that first form, the cassia, that really is probably the form that you want to look for, and that we've seen the best results.
Yeah,
And that
I like
will,
what you have here. I mean, how can you eat that much cinnamon? I think, okay, you sprinkle it on your yogurt. What are some other ways?
yeah, I mean, on your yogurt, in your oatmeal.
Okay.
The other thing that, now again, a teaspoon is 4.75 grams. A teaspoon's a ton of cinnamon, right? But right, that's a
That's a
lot.
lot.
If, you know, to put on oatmeal, it's gonna really be a little too much. You may want to try like a hot liquid, like a tea,
Okay.
or even hot water, and putting it in there and warming it up. It's still gonna have the same effect.
Interesting.
So,
Okay, as we're rounding the corner, the last one is chromium.
okay, and chromium is a mineral as well, and its function may enhance insulin's action, just kind of how we mentioned with cinnamon as well, and it encourages glucose to go into the cells. So for adults, the amount that's listed here, so here's another acronym, AI, which stands for adequate intake, and that's different than the RDA or the RDI that we were just talking about. The reason that the term AI is used is there aren't enough studies on it to know how much is really recommended. These are just estimations from some of the epidemiological or population studies that are out there. So this is the amount that's recommended for adults. We call it a trace mineral because it's really needed in very small quantities. And so we don't need a lot to see that it works. And really, again, just getting a diet that has some of these food sources in it. And I really like to point out whole grains, nuts, and mushrooms, because those tend to be the healthier versions of the foods that are listed there, and things that would be great for a good balanced diet.
Okay. And last
So
slide,
if you're,
some resources.
yes,
This is
is
great, actually.
I'm sorry?
I'm sorry, this is great because so often there's so much misinformation out there, and then you get somebody's blog post or whatever, and you want to know what is the real deal.
Yes, and this is updated regularly. This is a resource from the National Institutes of Health Office of Dietary Supplements. And so we've provided the link there for you, but this is just a snapshot of what you'll see when you get to that website. And you can just either go through and look for an individual nutrient or mineral, or as you can see on the other side, it will say, oh, okay, if you want specific supplements for a disease state, for example, so diabetes or weight loss, those you just click on there and it will show you what is the most up-to-date information on these different supplements.
Thank you. That's a really useful resource, because then you could find out a lot more information, and you know that it's coming from a reliable resource, a reliable source.
Absolutely.
Yeah, and as we thank you for attending, I also just want to put in a plug to be sure that you bring in a list of everything that you're taking when you go to see your primary care provider, because it's really important to understand. I know, like the story I tell about my mother, she was having she was having diarrhea because she was taking way too much magnesium, because she had it in her multivitamin. She was taking it separately because she heard it was good for your skin, and then another form, she had it and wasn't realizing it and was really struggling. And so if you bring in your list, your provider can look at it, or your diabetes educator, and really get a sense for, are you doubling up? Are you missing something? And that way the whole team is involved.
That's a great, great recommendation. And I think a lot of times we think of putting medications on a list, but not if we're taking vitamins or supplements. So they should actually be right there with the medications. So great tip.
Excellent. Thank you all for your attention.
Thank you.